When should I see a doctor for a boil on my inner thigh near the groin as a female?
Hello, and welcome to today's video. Today, we will discuss a health issue that can cause discomfort and concern: a boil on the inner thigh near the groin. More importantly, we will focus on understanding when it's necessary to consult a doctor for this condition.
What is a boil?
First, let's define what a boil is. A boil, or furuncle, is a painful, pus-filled bump that forms under your skin when bacteria infect and inflame one or more of your hair follicles. Boils can occur anywhere on your body, including the inner thigh and groin area.
Normal boil symptoms.
A typical boil begins as a reddened, tender area, which over time becomes firm, hard, and increasingly painful. Eventually, the center of the abscess softens and becomes filled with infection-fighting white blood cells. This process leads to the accumulation of pus. The boil becomes larger and more painful until it ruptures and drains.
When to see a doctor?
While most boils will resolve on their own with home treatment, there are certain situations when you should seek medical attention. If you experience any of the following symptoms, you should consult with a healthcare provider. 1. The boil is not improving or is getting worse after a week of home care. 2. The boil causes significant pain or discomfort, or is located in a sensitive area like the inner thigh or near the groin. 3. You have a fever or other systemic symptoms such as fatigue or a general feeling of illness. 4. The area around the boil becomes red, painful, warm, or swollen, as this might suggest a spreading infection. 5. You have recurring boils or boils that occur in multiple family members. 6. You have an underlying health condition that weakens your immune system, like diabetes or HIV.
What can a doctor do?
A healthcare provider can evaluate your boil to determine the severity and the best course of treatment. They might drain the boil or prescribe antibiotics, particularly if the infection is spreading. In some cases, they might also test the pus from the boil to determine what type of bacteria is causing the infection, which can guide treatment decisions. Remember, if you're unsure about whether to see a doctor for a boil, it's always better to err on the side of caution. Your health should always be your priority. I hope this video has provided you with valuable information and guidance. Stay safe and healthy.